All right, so we are reviewing one of my most popularly asked about videos. This is a blog that we did almost 4.5 years ago now on a YouTuber named Simmi Singh. She's a beautiful, talented, funny, amazing patient of mine who we did a surgery on. And I get a lot of comments, a lot of questions about the surgery, about what we did specifically for her nose, how we made those changes. So I wanted to kind of just rewatch the video with you guys and share a little bit more detail about exactly what we did and how we did it. When you looking at the video, like right now we're looking at the local anesthetic part of it. This is really important. I'm going to pause it here. The local anesthesia part of it's so important because you want to make sure that you're vasoconstricting the nose. What that does is it decreases the amount of blood during surgery. You're making all the blood vessels vasoconstricted so you don't get as much bleeding. The reason that's so important, especially in closed rhinoplasty, is we're operating in such a small space that we need it to be a basically bloodless field. That happens from multiple things. One is being in the right surgical plane. So a lot of surgeons that do closed rhinoplasty and don't love the technique or feel like they can't see enough, it's usually because they're in the wrong plane. Surgical procedures are all based on planes. Ask any surgeon in the world, whether it's a facelift or a tummy tuck or a nose job, it's all about planes. And so your tissue layers, you have multiple planes in the tissue lanes. And if you're not in the right plane, you're going to cause lots of bleeding because that's it. You might be in a plane where it's very vascular, lots of blood vessels. So being in the right plane is number one in closed rhinoplasty. And then number two, doing the injection properly allows you to vasoconstrict whatever blood vessels there are so you have way less bleeding. So that's a really important part, especially in a surgery where you're doing closed approach. You see here we're cleaning the face and scrubbing, and I'm getting scrubbed up. Sterile technique is super important in rhinoplasty. You don't want to introduce any bacteria. The first step we're doing in her surgery is deviation of the septum correction. So you see we're removing these large pieces of cartilage during the surgery, and by removing these large pieces of cartilage, we're able to reduce the obstructions that she have inside the nose. So inside the nose is very common for someone to have a deviated septum. One misconception is if you have one, you have to get it fixed. That's absolutely not true. A lot of people with deviated septums do not need their septum fixed. You only need your septum fixed if it's deviated enough that it's impacting your breathing. Some people have deviated septums that are not requiring them to have their deviated septum fixed. Some do. So it just depends on your septum. So that's the first step. You see we're removing these large pieces of cartilage out of her, and we're really describing how we're removing them. Then the next thing we're doing after that is now we are cleaning it up, making sure it all looks good. At the end of the case, we'll come back and stitch the septum back up. We do a quilting stitch so that we're able to put the septum back. Now we're doing what's called delivery of the tip. This is a technique that we do once in a while whenever the tip is very divergent or bulbous. In Simmi's nose specifically, she had very what we call divergent nasal domes. So the nasal domes, the tip, were very divergent. So instead of sitting together, they're sitting apart. The domes, the tip, are the two pieces of cartilage that come together and form this nice, beautiful triangle or diamond shape that we all like in rhinoplasty. But when they're sitting apart, it's considered divergent. That is exactly what Simmi Singh's nose had. And so by stitching those domes together, we're able to take away that divergence. But in order to do that, you have to expose the domes. So here we're showing how we're exposing them, taking both of them out. And then what we're going to do is we're going to stitch them together with very special stitching techniques in order to pull the domes back in. So I'm showing here how, some of the domal increasing that we did, and then how we architecturally will re-put those back together inside the nose to make it less boxy. It becomes more triangular. This is a very specialized technique. I do admit that a lot of patients could be beneficial for open rhinoplasty, which is another technique that we don't perform. Open rhinoplasty is where they make a cut at the base of the nose, lift up the hood of the nose, reconstruct the nose, and then you have a little scar the rest of your life. But for a lot of patients, it's much more beneficial if your tip is requiring a significant amount of work, because you'll be able to do a better technique with the tip sometimes. So it depends. Consultation is important. Now we're showing how we're getting into the dorsum of the nose and how we're shaving it down. We're shaving down the profile a little bit, removing pieces of cartilage. This part of the surgery is super important to be really careful to not overshave, especially in someone like Simmi's nose where she has a strong tip. If we shave too much, you could really make it look bizarre. So it's important to shave as little as possible. We use really sharp instruments, 15C blade, and then we use sharp maltz rasps in order to shave down the profile. Then we're showing here the placement of the spreader grafts. Spreader grafts are really important. These are cartilage pieces that we took from the previous part of the septum that was crooked. We carve it into these little straight pieces that you're seeing. These little straight pieces are what allow us to fix the middle third so it doesn't pinch or cave in long term, and also it allows the nose to look and appear straighter. So I'm very, very, very big fan of using spreader grafts in the middle third of the nose in order to soften the middle third, keep it strong at the same time, and not allow it to pinch in. So now we're going back to the tip. We're doing a little bit of sculpting to make the tip a little smaller. We're doing cephalic trim, a little bit of trim along the inferior edge as well, just to soften it. We don't want to do too much or remove too much cartilage. I think a lot of surgeons overdo removal of cartilage. That's one of the biggest mistakes in rhinoplasty, in my opinion, because then you lead to a weaker nose. So you want to make sure that you're taking out as little cartilage as you need to reshape the cartilages, and then utilizing your sutures to really do most of the shape and framework for closed rhinoplasty that requires delivery. Now you're showing how we remove just little tiny segments of it, not too much, very subtle. And then what we're going to do now is the remainder of this tip, we're going to now sculpt and suture these together using techniques to bring them in to triangularize the tip. And I showed here also how we took out some more on the right side than our left side because we wanted really to give that equal versions of both sides, because most people have asymmetric anatomy. Left side or the right side might be bigger or smaller, so we want to even it out in surgery. What I always tell patients, it's not about how much I take out, it's how much we leave in. How much we leave in is what creates symmetry with noses. Then we're showing how we stitch the tips together, but now we're also showing how we're narrowing the nasal bones. So narrowing the nasal bones is called osteotomy, very important. I get asked a lot, do you break the nose? It's kind of this taboo question that a lot of people ask. Traditional breaking of the bone, we don't do, but as you show here, how we narrowed the bones to bring them in to make them softer, we use little tiny instruments, make small little tiny cuts along the edge of the bone to bring those bones in, just to make it a little bit more contoured permanently, so we're repositioning the bone. But we don't actually remove any of the bone, we just reposition them. So you can imagine the arc of the bone, instead of sitting out, now sits in, so you get a narrower version of the same nose. Now we're showing all the closure of the incisions on the inside of the nose. Using our closed Scarless technique, we allow ourselves to close all the incisions without any external cuts or scars. So whether it's a makeup artist, your friend, family member, someone you're sitting and having dinner with, there'll never be any cuts or scars when you do closed rhinoplasty. That can be a telltale sign. Again, most patients who do open rhinoplasty heal really well, but if you are that 1 or 2% who have a nasty scar, it can be life detrimental. It can be terrible for you if it wasn't necessary. So I always say be very cautious with doing open rhinoplasty. If you're able to do closed, it's always the better way to go because it's lower risk. But if you need open, you should do it. So I'm not a proponent of one or the other. I'm a proponent of what's right for you. I just happen to do closed rhinoplasty. So if you're a good candidate, I will do surgery for you. If you're not a good candidate, I'll refer you to my colleagues who are phenomenal masters of open rhinoplasty as well. All right, so here we are. Now, cast day, we just took off the cast. You're getting a peek at the 1 week reveal. A lot of people ask me, how the hell is there no bruising? I'll be honest, half of my patients don't get much bruising at all. Half do. The half that do get some bruising, usually it's completely gone by 1 week. And the half that don't get much bruising, it's usually, just a little bit of luck. I do everything in the same surgery for every patient to try to minimize bruising. Some really special manual techniques that I have to reduce the bruising, but I can't guarantee it. But in her case, literally almost no bruising, looks amazing. I'm really happy with her result. The good thing is, I like looking at my 3 to 4 or 5 year post-ops, because that's where you really see the art and the science of what you did in surgery. A lot of surgeons will show on the table results, or they'll show 1 week post-op results. Those are completely not to be believed. You have to see 4 to 5 year results. The same goes for fillers and injectables. I see a lot of people doing nose threads right now. I hate nose threads. I think that's the worst idea in the world, to be honest. I don't think it helps noses. And most people doing that also only show you the immediate results right after they did the thread. They don't show you a 6 month or 1 year result. So that's really important. And then, at the very end right now, we get to see a little bit of her before and after photos, and you get to see the finesse. These are taken months later, so these aren't the 1 week results. These are almost a year results, and you get to see how we really contoured the nose, sculpted the tip, lifted up the tip, shaved down the profile, and aired the bones, improved the breathing, and fixed the middle third, all with a closed Scarless rhinoplasty. So thanks for letting me break this down for you. I know we get so many questions. I get asked about this one all the time, and I just want to take some time to share the inside scoops behind the scenes of my own thoughts. Thanks for listening. Thanks for watching. Subscribe. Keep watching. We're going to be posting a lot more videos. Thank you.